நீங்க சேஞ்ச் ஆகணும்னு நான்
Good afternoon to one and all. Myself, Dr. Gomathi, Professor and Deputy Head of Department of Biotechnology. We would like to create awareness among the public and students about the Alzheimer's disease as a part of the institutional social response. So, what is the Alzheimer's disease? Alzheimer's disease is a disorder which occurs in our old age. Okay, so there are a lot of etiological factors behind the causes of the Alzheimer's disease. They say it is an old age disorder. It comes only to the geriatric patient, but not the case. Even nowadays, below 65 years of people also getting the Alzheimer's disease. It's maybe due to the change in their lifestyle kind of thing. Okay. So when we talk about the Alzheimer's disease, we all know that the famous symptoms of Alzheimer's disease is the dementia. Dementia means we might forget what we are doing, our daily activities we might forget. We won't be knowing what things are happening, and we will replace. Things has to be kept at somewhere, or we might forget our name, our kids, something like that. Okay. So mainly they say that the reason behind the Alzheimer's is there is a severe inflammation in the brain, and because of that damage occurs. So why in old age the inflammation occurs? Why such damage happens? All these things we'll be seeing in the next slide. Okay. So this, PowerPoint presentation will cover the overview, signs and symptoms and causes, diagnostic test, and how can we manage and treat, and also the prevention of the Alzheimer's disease. So what is mean by Alzheimer's disease? Okay, Alzheimer's disease, which leads to the gradual deterioration in memory, your cognitive abilities, and also your organizational skills. Okay, so we all know that human beings are called as much advanced when compared to the other animals, because we have a very good cognitive abilities and organizational skill. We will be knowing where we are going, what we are doing, and what we are eating. So many things. But when we forget all those things, okay, so if I would have ate my breakfast, if I'm a severe sufferer of the Alzheimer's disease, I would have ate my breakfast, but I would have got forget, and I would scold my caretaker, you didn't give breakfast to me, I didn't eat, because I would have completely forget what I am doing. Okay, so like that, I might forget to brush my teeth, or where I'm going, whether they're all my children, or what is their date of birth, when they got married, everything. Totally, I will forget everything. I won't be having any organization skills also. If the dress has to be kept in the almirah, I might keep it in the somewhere else. Toiletries, I might keep it in the fridge. Whatever the things I might kept it in the fridge, I might throw it away also. So that kind of complete irrelevant things, and there will be the complete dementia happens, and we won't be knowing anything. Actually, in old age, if we get something like that, we forget everything. What happens? Our life becomes a hell. So, I would like to clearly mention what is the clear difference between the dementia and the Alzheimer's. If a person is having a dementia, it doesn't mean that he will have an Alzheimer's. Even nowadays, young people is also having a mild dementia kind of things. They also forget a lot of things. Okay, so what actually dementia describes? The dementia describes the state of a person's mental function. Okay, so the dementia is not a specific disease, it's not a disease or disorder, it is a symptom. So for a range of symptoms affecting the memory, thinking, and social abilities. But in Alzheimer's, the dementia is one of the symptom. Okay, it's one of the symptom. Also, there will be the progressive decline in the cognitive function and also in their organizational behavior. Okay, so in Alzheimer's, dementia is one of the symptom. So what is the dementia? What kind of things we get when a person has a dementia? When we have a dementia, your memory will completely decline, and there will be decline in the reasoning and your communication, your language, your visual understanding, and also your behavior. Okay. So what are the stages of Alzheimer's disease? Okay, so when we talk about the Alzheimer's disease, we should understand the progression of Alzheimer's disease also. So like every disease or disorder, it also has a preclinical stage and mild and severe. Okay, so what is a preclinical stage? Maybe if I am much aware about, if I have more knowledge about the Alzheimer's, and if somebody is, my family has a Alzheimer's, or I am above 60, I might think that I forget a lot of things. So why don't you go to the doctor, check for some biomarkers, whether I might get Alzheimer's or not. So when I go and check for some biomarkers to find out that whether I might get Alzheimer's, so that kind of identifying the biomarkers without any symptoms, then that is called as the preclinical stage. Okay, in this stage, individuals might not show symptoms but may have biomarkers which indicates that the person might get a Alzheimer's disease. Okay, the next is the mild cognitive impairment due to Alzheimer's. So what does this stage actually leads to? Okay, it is characterized by the slight memory and cognitive decline beyond what is expected for age. Okay, everybody will forget something. Okay, but the more the cognitive decline and memory beyond your age happens. Okay, so at least that time we have to analyze ourselves that something is happening in our body. We should go and meet the clinician. So next stage is the mild dementia. In this stage, what we encounter, there will be the early stage where complete memory loss and cognitive decline become more noticeable. Okay. The next stage will be the moderate dementia. Here, the symptom versus more. You will be interfering with daily tasks and independently you won't be able to do anything, and you will lose the complete independence. Your symptoms versus from the mild dementia, there will be the more memory loss, more cognitive decline, and you will be having to perform your daily tasks. Okay, so the next stage is the severe dementia. So in severe dementia, what happens? You will have a significant memory loss and inability to communicate or care for oneself. So in a mild stage of Alzheimer's, individuals may experience difficulty finding words and misplacing objects and facing challenges in making plants. Okay, so they will be like completely like a vegetable. Okay, so they won't be able to feel who they are. They might forget what they have done in their past. They won't be knowing their relatives, and even when they want to communicate, they will find problem in connecting the words and deliver a speech. Okay, and they will also misplace the object, and if they want to go out, they might forget where they are going, and come back to the home will be the difficult. So lot of things is happens to the person who suffers from the Alzheimer's disease. So why these Alzheimer's disease are caused? Okay, scientists say that it is initiated by an abnormal accumulation of the protein, particularly amyloid and tau protein within the brain. Okay, so why this abnormal protein accumulation happens? Okay, when we are young, what happens? There will be the proper cellular mechanism, the cellular machinery, chaperones and proteasome. What chaperones will do? Chaperones, what it will do? It will, whenever the proteins are getting aggregated or misfolded, it will try to refold the proteins into the native form. Okay. So, if the chaperones could not able to fold such proteins into the native form or the proper form, the proteasome come into the existence and it will cleave or chop the misfolded protein. So this is what happens. There will be the proper balance between chaperones and proteasomes. If chaperones could not fold that protein, the proteasome will come into the action and it will it will chop the misfolded protein. So this is what happens in our body. But when age advances, what happens? Our cellular machinery, our cellular system is also, there will be some imbalance between the action of chaperone and proteasome. Because of that, what happens? There might be some decline in the chaperone activity, or there might be decline in the activity of the proteasome. Because of that, the proteins which are misfolded gets accumulated in your brain. Okay, it can be, the most proteins which are accumulated in the case of Alzheimer's, they say it is the beta amyloid and tau protein. So these proteins accumulate within the brain, and because of that accumulation, what your system will consider is that these proteins are some foreign body, and antibodies will be raised against that, and because of that, severe inflammation happens in your brain, and due to that, there is the major deterioration happens in your brain, and there will be the leads to the death of the nerve cells. And because of that only it causes the memory loss, cognitive impairment, and disorganizational skills. Is Alzheimer's disease is hereditary? Now scientists say that presence of the ApoE epsilon 4 gene heightens the vulnerability to Alzheimer's disease. They say that this gene increases the vulnerability. People who has the presence of this may have the vulnerability to the Alzheimer's disease. Also, having a first degree relative with the Alzheimer's raises individual risk by 10 to 30%. For example, if my father or mother is having a Alzheimer, there's a 10 to 30% of a chance that I might get the Alzheimer's disease. Also, there's a connection between the trisomy 21, that is the Down syndrome, which elevates the risk of early onset of Alzheimer's. The person who already is suffering of the Down syndrome, he has a lot of chance that he might get the Alzheimer's soon when compared to the normal people. So what are all the diagnosis and tests and overall health assessment? As we all know that a holistic evaluation of the patient's general health condition to identify any potential underlying issues. Current medication, reviewing the medication to assess what kind of things they are taking, taking to assess the potential effects on the cognitive health. So now the clinicians are prescribing the choline esterase inhibitors. Drugs like donepezil and rivastigmine are commonly used to slow down the cognitive decline in Alzheimer's patients by increasing the acetylcholine levels in the brain. So how can we prevent the Alzheimer's disease? By staying mentally active. So how can we make our mental strength? Engage in activities that stimulate the brain such as puzzles, reading, learning new skills to maintain the cognitive function, or learning a new language, or doing a lot of puzzle, something the more work you give to your brain. Get physically active. Instead of staying lazy, we can do regular exercise, which promotes overall health and reduces the risk of cognitive decline. Okay. Also stay socially active. Maintain social connections through interaction with friends, family, community groups to support emotional well-being and cognitive health. So we can share our things, we can go out and enjoy. So we connecting, active socially is also makes us, makes us feel happy and releases our stress. So which in turn helps to prevent the Alzheimer's disease. Also, eating healthy things like eating vegetables, whole grains, fish, healthy fats to support heart and brain health. Okay. And if you have other risk factors such as head trauma, depression, and cardiovascular health, through regular screenings and treatments, when you're able to regulate these things, which also helps in the prevention of your Alzheimer's disease. So once if I get a Alzheimer, what is my average life expectancy? For individuals, it was diagnosed from 4 to 8 years. But it is not like that. Okay, people can able to survive more than up to 20 years after, after they diagnosed with the Alzheimer's. We all know that Alzheimer's is only after 65 years. So after 65 years, how long the life expectancy of a man or woman? Okay, so death at 70 or 75 is also a normal thing. Okay, so it's not like because of Alzheimer's disease they die. Maybe it is also because of their old age. So the average life expectancy of individual maybe cannot be determined by the Alzheimer's severity of the Alzheimer's disease. People can able to survive even after diagnosing the Alzheimer's. They can able to survive 20 years also. So with this, I would like to conclude my awareness talk on Alzheimer's disease. So Alzheimer's disease can be prevented even if we get mild symptoms. We all should go to the clinicians and get treated. So how can we prevent the Alzheimer's disease? By having a proper diet, also doing exercise and socially connect. So when we see Alzheimer's patient, instead of teasing them, we can help them because they have some condition, they have a dementia and they have the poor cognitive skills and poor organizational. It does not mean that the Alzheimer's disease does not come to us. Okay, one day there is a chance we might be also a Alzheimer's patient. So we have to treat those old people or geriatric patients as a normal person, and we should do whatever we can help them to achieve their life. And thank you so much. And I would like to thank our Honorable President for giving us this opportunity, and my head, Dr. Rajeshwari Hari, and my colleagues. Thank you so much.